The university is a research-intensive university. The priorities at Chapel Hill are to be a global campus. This would be impossible without the resources of the library. The library is part and parcel of this movement. The university cannot become a global university unless the libraries, including the health science libraries, become libraries recognized as libraries that support global universities.
When I came, I was really impressed with, in terms of my use of the library, how accessible the library has been to me. My work is mostly based in East and Southern Africa, and I do research on HIV in Tanzania and South Africa primarily. The kind of literature I tap into is not in the traditional public health medical journals. It's in social science databases and journals, and I think you've been very good about helping me look in other types of databases and in other places for the kind of literature that's really going to inform the work that I do.
About 10 years ago, we built facilities in Malawi, constructed facilities. One of the priorities was to have a seamless relationship with the library, have them train a librarian for the country, essentially. That's the health science library in the city of Lilongwe, the capital, is the UNC Health Science Library UNC project. So that's a very specific example, but that makes our Malawi program 10 times stronger than it would be without that.
I'm Dr. Adam Goldstein. I'm a professor of family medicine at the UNC School of Medicine, and I'm the founder and co-host of Your Health Media. We have a radio show that runs weekly in the community and is available by podcast nationally, internationally. We produce a newspaper column, and we have a blog. One of the things that was most exciting for us as we were getting involved in a social media project and a radio project and a newspaper column was to discover that, first off, we have a much different set of skills than people and staff that work in the Health Sciences Library, and they were very complementary skills. So there were things that we didn't know how to do or have expertise in, like developing a web presence or our social media site. We had no experience with some of the applications that we needed, like WordPress. And so to be able to find resources, and that this was actually part of the experience and expertise in the Health Sciences Library, was just opening up a window. All of a sudden, we're able to create synergy, and we're able to create projects that in their sum are much better than I think we could have created on our own. We've also been pleased to discover resources the library had that perhaps we didn't know, and maybe many of our colleagues didn't know either. Public portals for communication of information and responding to listeners about house calls and specific content. We might have some of the medical knowledge, but the patient education resources that are available and how to get those out in ways that are accessible to people, well, that's information that the staff at the Health Sciences Library has. The outcomes have been better, and it's also been more rewarding. When I'm doing a radio show now, and I hear us say that one of our sponsors is the Health Sciences Library at UNC, I'm really quite proud of that. The radio show reaches 30,000 listeners a week. We're actually thinking about the Health Sciences Library and talk with our colleagues at Health Sciences Library about posting resources that are available. One of the things that we've liked about our collaboration with Health Sciences Library is that our interests seem to intersect. It's benefited each of us, so we continue it, and that's a good collaboration. Previously, it probably was not a collaborative relationship as much as, at least for the physician, thinking, oh, what do I need? Versus now it's about, well, what can I learn?